Okay, so hi, my name is Myles. So first we have our muscles in our face. So we have our frontales, which raises our eyebrows. We have our temporales, which closes the jaw. We have our orbicularis, orbicularis oculi, which closes our eyelids, and then orbicularis oris, which closes our mouth. So next we have our chest muscles, and first we have our pectoralis major, which is shoulder flexion, adduction, and medial rotation. And we have pectoralis minor, which is the downward scapular rotation. Next we have our erector spinae, which is a trunk and neck extension. So next we have our upper extremities. We have our deltoid for shoulder flexion, our trapezius for neck extension. We have our supraspinatus for shoulder adduction. We have our intraspinatus for shoulder lateral rotation. We have our teres minor. We have our teres minor for shoulder lateral rotation also. We have our subscapularis, which is for shoulder medial rotation. Shoulder medial rotation. And then we have our bicep brachii for elbow flexation and forearm supination. We have our tricep brachii for elbow extension. We have our flexors for wrist flexion and finger flexion. And we have our extensors for wrist extension and finger extension. Okay, so now we have our lower extremities. First we have our sartorius, which is hip flexion and knee flexion. Next we have our gracilis, which is hip abduction and knee flexion again. Then we have our adductor longus, which is hip adduction. Then we have our rectus femoris, which is hip flexion and knee extension. Then we have our soleus, which is ankle plantar flexion. And then we have our tibialis anterior, which is ankle dorsiflexion. And last but not least, we have our gluteus maximus for hip extension, lateral rotation, and abduction. We have our biceps femoris for hip extension and knee flexion. And we have our gastrocnemius for ankle plantar flexion and knee flexion.